Researchers at the University of Chicago and Chapin Hall embarked on a study to understand how social determinants of health interventions could be used to promote health equity among Latino families. We were interested in understanding the social and health needs of Latinos because research shows they are an important and growing part of the U.S. demographic. However, we also know that Latino families and children face pervasive socioeconomic challenges, including poverty, uninsurance, and lack of access to the social safety net. For both families and children, these adversities could be detrimental to health and well-being over time, contributing to stress among families, the resources caregivers and families are able to provide for their children, and both children and adults' mental health. In the research, social determinants of health and programs that aim to screen and refer families for unmet social needs have become increasingly popular. We evaluated a program called Dulce, a 6-month social determinant of health intervention that was implemented among families with newborn children. For our study, we wanted to know how Dulce worked for Latino families and how it worked specifically for immigrant versus U.S.-born families, and what aspects of the program were most and least effective. We engaged in a mixed method study where we conducted a quantitative analysis of survey data and then used those findings to engage in a qualitative data analysis to gain a more nuanced understanding of the Dulce intervention. For the quantitative analysis, we assessed survey data among nearly 400 families that was collected among families at the beginning and end of the Dulce intervention. We applied quasi-experimental methods to better estimate the effects of Dulce on caregiver outcomes, including resilience, stress, and depression. First, we find that Dulce had a positive impact on reported levels of resilience for Latino families. Resilience is a multidimensional measure that captures individuals' ability to thrive and weather challenges and adversity. However, we did not see any changes in caregiver depression or stress from participating in Dulce. Second, when we examine the effects of Dulce by nativity, we find that the effects are more pronounced for immigrant caregivers, suggesting that Dulce was more effective at benefiting immigrant families over the U.S.-born. With these findings, our qualitative analysis sampled families to understand why Dulce improved resilience. We specifically recruited both U.S. and immigrant families who experienced both increases and decreases in resilience for hour-long interviews. Our qualitative analysis showed that the family specialist was a key component of the Dulce program. Mothers who reported increased resilience described having a trusting relationship with their family specialists, who often normalized the challenges of raising a new baby and offered them key supports. For immigrant mothers, many discussed raising their children in isolation without the help of family, friends, or social services. So their family specialist was an essential lifeline and companion among mothers who otherwise had little support in raising their children. Based on our analysis, we outlined several key recommendations for social determinant of health interventions for Latino families, including ensuring that a near-peer role like the family specialist is built into these programs and extending the duration of programs to have an impact on resilience and other outcomes that perhaps Dulce was unable to improve. For more information, you can visit the study website on the Chapin Hall website or contact the study investigators at Chapin Hall and UChicago. Thank you for your interest in benefiting the health equity of Latino families.